so glad to be doing this with you. I sent you a note, and as a gerontologist, I'm very happy to talk to someone who is someone who deals with families, because that's the biggest problem I find, that when, I mean, maybe this is what you find, then the seniors come by themselves, they don't know what's happened. I always think they should come with someone, shouldn't they?
Oh, yes, most of them, yes. Yeah, majority of patients are coming like by themselves, but sometimes they're starting to have declining on cognitive and in the memory, so they don't even know what date is today, and they're coming by themselves. So that should be happening to population like that.
That's true. So,
Mm-hmm.
Dr. Diaz, what made you want to become a physician? I always ask that of all our doctors.
I think it was I have been a person looking behind helping others. And there's no major experience that happened to myself or any of my family. So thanks God, that made me being a doctor. But it was more like service, and I love to help people. And genuinely, I like to study. And I think that was the perfect career for myself at that time, when I take the decision.
That's good. And so how many years have you been practicing?
Around 20 years already.
You have been practicing 20 years?
Yes.
You were a child when you started.
No.
That's funny.
No, but
Go ahead.
I have practiced in that many years without nonstop, it seems like many years, but for me, it's not like that. I'm enjoying every single day.
Yeah, well, it's interesting now that, years ago, there were very few physicians who were female. You know that.
Oh, yes.
And
I started.
I like to go to a female physician, and I think that you have, I hate for the doctors, the male doctors listening to this, but you have a lot of heart and a lot of understanding because you are a female. And I think there are many male physicians who are really interesting, and I know, and they're very kind and all, but I think a female, you're a caregiver.
Oh, yes. And my female patients are starting to tell me more frequent now that they are liking me because I'm a female, not because anything special. And yes, and I think it's like the instinct of helping and listening to others that I'm more aware of trying to fulfill all the things or the needs that they are coming to me with.
Yes,
And
and they feel more free, I think, to tell you
oh,
some of their female problems, which they don't want to tell a man, right?
exactly. And understanding sometimes being with a stigma or stereotype because it's a female patient, and when they are coming to me because they have been with other doctors that are male, and understanding and I'm listening from another perspective, they are very happy with that.
Yeah. Well, let me ask you now, as what do you think that your patients should be most concerned with? There's so many things that people have and problems, but in your list, what would you put as number one for people who are over the age of 65 to think about?
I think it's there's too much information, and people have and from in my perspective, it's good that people are or the patients are reading more and they're more knowledgeable than the patients that I used to have before the internet and all that. So now patients are coming with research done and understanding of most of the conditions. But what I'm seeing now is that the too much information sometimes is very confusing. So they are already telling me I don't want to take statins, for example. That's my major concern now because I have very good patients over 60s, 70s in a very good shape and healthy, but they are refusing statins. So, and they are having issues with the cholesterol. Maybe that's the only issue that they are coming on the priorities, the top three. That's a good maybe the third one that I'm trying to figure it out to manage to be very preventive. I love the preventive medicine because I think that we have a lot of opportunity and do better on that end. So, and I love wellness too. So if I can do that, no matter what age they are having, I think it's important to be educated, but also important to give us the trial of trying to starting your studying, see how you're feeling before even feeling the myalgia without even taking one pill. So sometimes it's hard in that end that they are very knowledgeable, but I try to educate and educate more and more every single day of my life. I can never gonna be tired of it, and I really, really understand that being on prevention is the key for us to have better patients at the end. So, and to solve their problems and to help them really.
I want everyone to know, I jumped into this so quickly, but this is Dr. Keyla. Did I pronounce that right? Keyla Diaz?
Okay. Yes, Keyla Diaz. Yes.
Keyla Diaz, and she
Yeah.
is a family doctor, and she is with Healthy Partners. Healthy Partners is a fantastic organization, and they're all over now, South Florida. So if you are looking for a doctor, I suggest that, of course, you can go and find Dr. Diaz. She is in Hollywood, but they have centers all over South Florida. And I want to continue this because it's interesting that I've been going to also a family practitioner. It's a he, but whatever. But he and I have high blood pressure that we're controlling. And he mentioned about exercise, and I want everyone to know that I've started riding an exercise bike, and my blood pressure has really gone down. And even though I'm on blood pressure medication, it's amazing. It's just what you were saying.
Prevention is the key. It's exactly like that. And we should be motivating more our patients to go back to basics. Health lifestyle, very good. Diet, if they can do Mediterranean, better for them. And to do exercise, even for myself. I'm all the time saying and that I'm a patient too, that I'm really need to do well every single day of my life. We're not going to be perfect, but we need to be preventive as far as we can.
I started taking steps and stair steps. I mean, we all jump on the elevators. And at first, as I was huffing and puffing up one flight, two flights, now I'm trying to make it a goal, go up another flight. And so I agree with you. And I think that, but a physician does have power. There are a lot of physicians that they write their prescriptions, but I think you need to write exercise and other things on your prescription pad because I
Oh,
think
yeah.
people will pay attention to that.
Exactly. And that's exactly what I'm saying. I'm saying to most of my patients, this is not, I'm not gonna be very tribal, like telling you do exercise because I want you to be doing exercise. It's part of your prescription. If we're not doing good, healthy lifestyle, we're not gonna be able to do well just with all the pills that we're giving to them, or even all the medications that we are giving. It's not only that, we're not giving miracles pill. We are doing an adjuvant of your treatment, that your first treatment should be healthy lifestyle. So we need to do lifestyle modifications more than anything else. And we cannot be tired of, or even not even mention it because we think that everybody knows. No, we should be relearning and reteaching and telling them that we should be more preventive than anything else.
And the one thing that is very important, and I know this, and I can tell that you're this way, when a patient comes in, you have to listen. I put
No.
a gerontology hat on, and I know that it's very important because these people, sometimes they see you once, twice a month or something, and they can't wait to talk to you. And if you're very busy and they don't get to talk, they're very unhappy.
Oh no, yes, that's part of what I have been doing for 20 years already, Like I need to listen and listen and listen and then start to do a plan with them. It's not my plan, it's not my numbers, it's their numbers, it's their health. So I need to figure it out how I want to be treated whenever I sit down as a patient. So when I'm seeing from that side, I'm going to do my best to do my best with each of them, not because this is an important person and the other one is not. I treating them everybody as the same, because I need to see even myself in that chair that I have been many times, and I really want to be treated like that. So that's what I'm all the time listening and trying to do my best.
Like,
Even though I have no good days, I don't need to show them, you know. I try to, because I'm as human being as everybody else. So that's what I've been doing all my life. So
my guest is Dr. Keyla Diaz, and she is affiliated with she is a family practitioner, and she is with Healthy Partners, and they are incredible medical practice all over South Florida. I did want to ask you something, though. When we go to a doctor, they always give us these pages to ask us about our family, about, you know, what diseases they had, what's going on. And sometimes you say, why do they want to know all this? Would you tell us why that's true?
because that's part of your genetics. So there's things that we have control and there's things that we don't have control. So we already talk of the ones that we have control with the lifestyle management and modifications and the exercise. But there's another piece that I need to know to do better on each patient, and is to know what about their genetic part, that sometimes that is came with you, that came with all of us, and we have no control of what that, but we can be even preventive to know if their mother or father died of a stroke or a cardiovascular disease or any cancer. So there's predisposition and conditions that could be genetically expressed again, and patients can be at risk and they don't even know that. Probably we're looking forward for that, so I could be more assertive whenever I'm doing my diagnosis assessment, so, and even my treatments in some occasions. So that's why we're asking a lot of questions.
And it really does make a difference if someone's family member died of heart attack or cancer and they've not had any problems.
Exactly, because we can assertively be looking forward for the on that end. For example, colon cancer is very important to know. Breast cancer in some instances are expressed genetically in some families. So and prostate cancer, then some of them are genetically predisposed, pancreatic, and some other conditions that we can even preventively looking at that. Even diabetes. It's there's sometimes that patients are starting to have more weight and not doing the best on their diet. And whenever I see that part of his families or her family were diabetic on the past, so I can assertively say, oh, come on, you can do better on your diet and in exercise, so we can even prevent that to happen.
So actually, there are a lot of people that have diabetes, and it isn't number one. It's the second one that comes from, I guess, overeating or not eating properly. So tell us what people should do to avoid diabetes.
And it will be sounds like very repetitive, but one of the things that we can do is to a diet more toward less processed food, and I'm meaning carbs, and I'm meaning like be careful with the rice, the pasta, the bread. So we can do that, but if it's whole wheat, it's a better one, and we can do with a portion, controlled portions, and to have snacks that are very healthy, snacks on carbs and proteins that are healthier than maybe the ones that sometimes we choose that are not good enough. So, and do more exercise and try to avoid all the sweets and the cookies and all the things that we really know, but we should be doing better and better on try to do one modification at a time. Sometimes even soft drinks that people are having that are not healthy at all. So do more water. But sometimes I get to the point in most of my diabetic patients, or the ones that are in risk, that I really ask them, what are you taking? What are you eating yesterday, today? So, and start to look for that kind of opportunity. Do more this, less than that, and start to talking about. And every single visit, we have like a chat of how you're doing on your diet. But not only are you doing healthy or not, I get to the details on what things they are buying, because with all the information that my patients are having, they're very confused on what is keto, what is a low carb, what is paleo, what is, so it's too much information that sometimes very confusing. So that's the type of conversations that I remember as a child saying, talk to your doctor. So I learned that one. I talk to my patients because they need to know specific details of what do's and don'ts they should do, and even likes and dislikes. Because maybe I'm saying Mediterranean diet is perfect, but what about if they don't like that? So what options they have? So we need to have conversations regarding that.
Well, how does one know that they have diabetes?
And there's no specifics, and this is something that I even laughing, not in the bad way, but there's no specific symptom like a headache. It's more toward diabetic. So whenever someone is eating more, like no satisfaction, and they need to eat, whenever someone is having more urination during the day or during the night, or if they are having a, a lot of thirsty. So that three things, and even a weight loss without doing anything, and they're losing weight, that's some of the signs or predominant signs and symptoms also of diabetes could be there. So that's really important whenever I asking them about them. And patients that are really having those changes, they are clueless that they are having a diabetes already on there.
Yeah, so that's why I thought it's important. I want to go back to something you said, because it's hard for me, and I'm sure it's hard for people. Water. Why do we have to drink so much water, and how much should we be drinking?
Yeah, and that's very interesting, because even with patients that are diabetic, telling them to have more water because we want to prevent kidney damage, they're like, what? And yes, and you should do a lot of hydration. If you don't have any issues that are or medical conditions already indicating that you should do a specific amount of water, if you're not that type of patient. So keep your kidneys hydrated as much as you can. And possibly if you're a regular adult that don't have any other issues, you should do at least at 64 ounces, more or less, during the day to keep yourself. And having a whole bottle of water on one sip is not good enough. So it's not a healthy thing. You should be having liter by liter during the day. In my patients that are very elderly already, they should be avoiding having too much of water at night, because I don't want them to be awake all night. So do your best during the day, and try to avoid during the night much water. So it's kind of a little bit of tricky, but whenever we talk about it, they becoming doing better, because a lot of things we think that our patients know everything, and we shouldn't be taking that for granted.
Right.
That's
Well, it's interesting. But I try to eat a lot of fruit. The water in the fruit, isn't that making up for some of my water?
not exactly. Water is water, and fruits and fruit. And on the other hand, and talking about fruits and diabetes, we should be very careful of having too much of high glycemic fruits in the day. So what that means, so we need to instruct or educate our patients in what kind of fruits they should be taking to avoid having higher blood sugar levels. So one of the things, for example, is mango, be careful with that, with the banana, half of it. So that's the type of things we need to educate them a lot, because they think that they can have all the fruits because that's healthy, and portions are important.
That's very good advice. So, of course, the saying "an apple a day keeps the doctor away." We don't, but I guess
That
apples because it's more solid, isn't it? And so
it because glycemic index is less than others. So you have pineapples are very high in glycemic index. So if you're gonna have pineapple, it should be a portion of it. If you're gonna have mango, you have to be in a portion. Even the apple shouldn't be a huge apple. A medium one, it's the amount that we are telling our patients. With berries should be a cup, and you cannot have all of this that I'm mentioning in one day. So portion, snacking, and at least 2 or 3 servings of fruits a day should be the goal.
Dr. Keyla Diaz, you are full of such good information. It's just so much fun. We have about 5 minutes, but I wanted to ask you about people who, of course, they're getting hip problems, back problems, and they don't want to exercise, but walking is pretty good, isn't it?
Yeah, walking is good, but before you walk, you need to do stretching. Stretching is very simple, just like to tell your muscles that you're gonna do an exercise. Because one of the things that I have been seeing is that patients are doing walking, but they are not stretching. And you should start walking, not like running, but start walking little by little, getting warm. So telling your body, I'm going to do exercise. Whenever you are done with your walking, you should calm down and cool down a little bit and do a little bit of stretching. So that has been something that we are forgetting to do, and it's very important, and it's make a dramatic change on these problems to my patients. I'm talking more and more about stretching because we all need to stretch out a little bit, not once, maybe 2 or 3 times a day, in things that you know that you're not good enough. So like your back is hurting or having some discomfort, preventive measures should be doing some stretchings.
Well, I think I'm guilty of that. I do some stretching, but not probably like you're saying. But I think all the medical advice that you've been giving, if you give that to your patients, you're going to have some very healthy patients. I'll show you. I wrote a book called "Live to Be 100 Plus," and that's what your patients are going to get up there, because I'm sure you have a lot of, if you think about it, years ago, people thought they were dying at 65 and 70, and now we know that people are, here Betty White lived to be almost 100 years old, right? Are you seeing a lot of
Yeah.
that?
Yeah, I'm having a quite number of over 90s here, that some of them are not that good, but most of them are pretty good. Even a lady that she's very, very good at 97. So you can do it if you follow, if your genetics are good, because that's something that in some instances are not in our control. But if you have good genes and good lifestyle, you can do well. And even if you're not that good on that part of your genes and you have some conditions, you can control them in early years to have a good life. So sometimes we screw up in our 40s or 50s, and we are not doing well in the long run. So if you want to have a good life, I tell my patients, the number is something, but it's the quality of life that you're gonna do.
Dr. Keyla Diaz, it's been wonderful having you on our show as an interview, and thank you so much for coming. I know that you're busy, but
My pleasure. My
yeah,
pleasure.
you're very smart, and I'm so glad that they invited you. So thank you again, and hopefully we'll have you on another time.
Oh, yes. Thank you. Have a good
Yes,
afternoon.
thank you, Dr. Diaz. All right, bye.
Bye.